One study showed that exercise dramatically reduced the risk of diabetes. Exercise increased from 500 calories per week to 3,500. Risk of diabetes dropped 48%. That says a lot for exercise. A proper diet also dramatically reduces a risk. A high protein diet promotes kidney dysfunction. It's true that eating a high meat diet can control blood sugars, but the number one cause of death in diabetics is heart and blood vessel diseases. American Heart Association has gone on record as saying 80% of diabetics die from some sort of heart or blood vessel disease. All animal products such as meats and any dairy items have no fiber, and fiber is emerging as a central ingredient in the control of blood sugar. Research shows foods with high fiber lead to a slower rise in blood sugar and less insulin is needed to handle the meal. Diabetic benefits of a high carbohydrate, high fiber diet are: it reduces levels of serum cholesterol and triglycerides, reduces blood sugar in those with hypertension, promotes discontinuation of insulin therapy for non-insulin dependent diabetics, reduces the risk of death from heart disease, improves gastrointestinal function, reduces body weight in the obese, reduces risk of kidney damage, reduces insulin requirements. Fiber improves glycemic control. Now here are the diseases associated with a low fiber diet: diabetes mellitus, constipation, appendicitis, varicose veins, hiatus hernia, diverticular disease, hemorrhoids, bowel cancer, bowel polyps, heart disease, strokes, and gallbladder disease. Now let's get into some interesting facts about the sugar itself. Note on the chart: if a person consumed no sugar for 12 hours, each white blood cell could destroy an average of 14 bacteria. If that same individual ate the equivalent of 6 teaspoons of sugar, which would be found in maybe 2 ounces of candy, each white blood cell could only eliminate 10 bacteria, a 25% decrease in killing power. And if a person had 24 teaspoons of sugar, they'd be down to destroying 1 bacteria. You can see why sickness is abounding, especially in obese people or people with poor dietary control. The impairment lasts about 5 hours in normal subjects, and if you had 24 ounces or 24 teaspoons of sugar, you'd have a 92% reduction in your ability to destroy bacteria. The average citizen consumes 147 pounds of sugar annually, and this equates to about 46 teaspoons daily. A sad commentary about sugar. To go a bit further, you can here see there are 8 cancers linked to sugar consumption: colon cancer, rectal cancer, breast cancer, ovarian cancer, uterine cancer, prostate cancer, kidney cancer, and cancers of the nervous system. Take a quick look at hidden sugars in foods, and of course this is teaspoons of hidden sugar. A study shows that the average American in 1994 consumed 52.2 gallons of soft drinks annually. That's over 64,000 calories of sugar. This is so powerful, you have to see it in writing. The average American in 1994 consumed 52.2 gallons of soft drinks annually. That's over 64,000 calories of sugar. 3,500 excess calories cause you to gain 1 pound. Unless you have a good workout program, that's about 18 pounds you will gain per year, just if you're the average American eating excess sugar. And of course, the obese Americans, I would think, are well above average on that. Interesting thought. And you might think artificial sweeteners, I use those. Well, studies show that they don't work either. Those people who drink the most diet drinks have the most problems with their weight. Studies shows that hunger increases after you drink diet drinks. They also increase the taste for sugar. A summary for diabetes and probably general all-around living: the less meat and dairy, the better. The less refined sugar, the better. The more fiber, the better. Eat a good breakfast and little supper, if any. And it's good if you have supper to have it at least 5 hours before you go to bed. Aerobic exercise at least 30 minutes per day. Try to put a few of these tips into practice, and you'll certainly be a healthier person for it. God bless, and I hope this helped.